Hi, everyone. Thank you for coming to my talk. My name is Lucas Ray, and I'll be talking about novel support device improving pedicle screw retention. I first want to thank the University of Minnesota Medical School, the Department of Orthopedic Surgery, and the Earl Bakken Medical Devices Center. And I specifically want to thank Professor Art Erdman, Dan Sachs, and the staff at the Bakken Medical Center for their support and their advice. To start my talk, we'll talk about osteoporosis, which is lower bone density. And this leads to increased fracture risks and also to hardware failure, and is one of the biggest issues in orthopedic surgery currently. The standard is to use a pedicle screw with or without augmentation, typically using bone cement, uh, known as PMMA. And augmentation improves this pull-out strength, but can be unpredictable during implantation into the vertebrae due to the ability to guide it into the vertebrae. And can always be hard to avoid vascular compromise and thrombosis in spinal surgery. So our goal was to find a way to improve pull-out strength without using augmentation, creating novel screw designs. And what we did was we compared it to the Solera pedicle screw from Medtronic, and we created three designs. One was a spring design, as you can see in the bottom left corner, using a single, double, or a triple helice with a nut and epoxy. We also created a corkscrew design, as you can see in the middle, with single and double helice with the nut and epoxy. And we also created a hybrid design, which I'll show you a little later, which was a half-length triple helice spring combined with the control screw. And what we did was we performed mechanical pull-out testing 3 times from foam blocks at 5 millimeters per minute displacement. And we performed statistical analysis using a two-way t-test. And we determined the ultimate load, which was the force at failure, ultimate extension, the displacement where failure occurred, and the screw removal energy, which was the area underneath our curve. So our first study focused on the spring designs, as you can see, the single, double, and triple, and focused on comparing this to the control screw. Now you'll see in the bottom right-hand corner our theoretical pull-out failure. We noted that the triple and the double helix had significantly increased pull-out failure. However, if you'll take a look at the graph on the left, the control screw reached a point where it reached true failure. However, the spring designs didn't reach that true failure, which is an asymptote at the top of these graphs. And you'll notice that this was determined from our regression analysis equation, which we provided here. And because we didn't see failure, but we did see improved pull-out strength, this indicated that this could be a concept that could be showing utility in similar designs, which led to our secondary study, which focused on the stiff prototypes with the double and single corkscrew and the two-part design, as we can see right here, with a triple helice spring shortened with our control screw. And what we ended up noticing was that the single and double actually didn't greatly improve pull-out strength, even though the failure or the error bar here, sorry about that, shows quite a bit of distance on the single screw. This was actually due to an error in one of our tests where we had a sudden jolt that caused a huge spike in our force displacement that was displayed on our machine, which kind of skewed our results for that particular run. But you'll notice that the two-part design actually had greatly improved and statistically significant improved pull-out strength by about 20%. And not only that, but it had greatly improved ultimate extension and screw removal energy compared to the control screw. And these were all statistically significant as well. And because of these positive results seen in the two-part design, further testing is indicated specifically in cadaveric bone. And some problems to consider in the future when studying this design is concerns related to fracturing of bone when inserting into the pedicle canal due to the concern for possible neural damage, and also finding a way to improve the design so that it can be inserted onto a non-flat surface, such as the insertion location into the pedicle. Thank you for attending my talk. If you have any questions, I will be happy to answer them. Thank you.